Dr. Jonas Apostol.
Hi guys, so welcome to my channel, and this is another episode of Smile Transformation. So this is a case of a 30-year-old female patient presented to my clinic with a chief complaint of having a symmetrical smile and a missing front. So let me walk you through the patient's case. So this is a very interesting case. As you can see here, the smile line is heavy on the left side because of the prominence of the canine, and the color is different from other teeth. And also, you can see here that she has a lingual locked upper right canine. It is because of the movement of the canine towards the lingual portion. So on her intraoral image shows that there is a slight extrusion of the upper left quadrant. Ibig sabihin, bumaba na yung mga ngipin on that side. It's because of the missing teeth on the lower left. So the purpose of the teeth, actually, it holds or it acts as antagonist. No? It acts as antagonist para hindi bumaba yung mga ngipin sa taas. Because of the law of gravity and the force applied during mastication, pag kumakain tayo, that's one of the causes bakit bumababa yung ngipin. So everything has shifted, no? Hindi na siya not on the right position. Let's say the canine on the upper left actually migrated to the almost on the lateral area of the teeth. That's what makes the case complicated, because we are looking at the mesiodistal length or space that will create a problem during the designing. But we're gonna do our best to ensure that we can be able to create a confidently beautiful smile. So let's see. So the patient is very, very beautiful, but because of the condition of her mouth or the teeth, bumaba na yung confidence niya. So it's really important to have a beautiful set of teeth to boost your confidence and to create more things with authority. So the patient is currently wearing a denture, which is removable, and that's actually gave her a bit of like consciousness that it might fall while talking. And also the lingual lock area of the canine is really causing her a anesthetic effect. So our goal here is to create a gorgeous smile for the patient to be able to match the beauty of the face. Diba? Kasi mas maganda yun para at least she will be more confident about herself and be able to address those self-esteem problems. So my treatment plan for this case is a combination of crowns and the bridge. On the front teeth, the canine to lateral, I'm going to use a Zirconia fixed bridge to be able to address the missing area. It's actually called the modified Andrews law for this case because the mesiolingual length is too tight for like a 5-unit or a 6-unit bridge. So this is considerable and a good treatment for this type of case. No? And also, I'm going to combine it with crowns for the canine on tooth number 1-3, and the premolars also treated with crowns. So why crowns instead of veneers? For this type of case kasi, there is an extensive caries on the multiple teeth, especially those who are affected, no, or part of the design. Sa sobrang laki nila, it actually parang extends to the dentin area of all surfaces of the teeth. That's why we have to treat it correctly. So crown would be the best. treatment option for this type of case. Although I'm an advocate of minimally invasive treatment, we have to consider the health of the teeth also. We just don't use veneers if it's indicated for crowns or vice versa or something like that. We have to be able to do a comprehensive dental assessment to be able to create a treatment plan suitable for the patient's case. So I did a design, a dentofacial design or dentofacial aesthetic design that is not just about the teeth, but also it should be beautiful in relation to the facial structure. Okay. Also, we are considering the color there, the distribution, the length of the teeth, and the width as well. So yun. So after doing, we will copy the design and yun na yung parang magiging gauge ko for my preparation, and also we're gonna copy that and enhance for the final result of the ceramics. So this is the teeth preparation. As you can see here, it's really invasive. It's because it's bridge and for crowns. But the good thing about this preparation is that it actually removes all of the unsound structure, and that would ensure longevity also to the case. So during the fabrication of the ceramics, it's not easy because we have to modify a lot and we have to ensure that everything's on point. Like we placed in some pink porcelain to make sure that we mimic the natural color of the gums, and also we have to place it strategically. Okay, hindi lang siya pwedeng ilagay lang kasi gusto lang namin. We have to make sure that it's cleansable as well, and the distribution should be on point. So it's not a walk in the park case, especially during the modification process. We have to ensure that we can deliver what we promised to the patient. So I chose Zirconia material for this because of its durability and aesthetic ability. I mean, you can be able to combine a hardness and also it mimics the natural structure of the teeth. So this type of indirect material or indirect ceramics could be able to last more than a decade, take care of it. I mean, we're talking about flossing of the bridge. You can be able to floss the bridge, by the way, so that it could avoid any bad breath or something like that, because most of the patients doesn't have any idea that bridge could be flossed. Okay, so we are actually helping or teaching our patients to floss the bridge, which is not really common, and the regular floss also na sa ibang ngipin for crowns. So one of the advantages of zirconia material is the hardness without metal. So being said that, there's no discoloration na mangyayari. Usually kasi we can see when they smile na parang merong metal or black on the cervical part of the teeth, which is very anesthetic or not pleasing. So in this case, in this particular case, hindi mangyayari yun because we are using an advanced technology, zirconia and CAD/CAM machine.
2 weeks later.
So after 15 days, the patient came back for the try-in. It took us 15 days because this is very, very complicated. It looks not complicated, but it is very complicated. So here is the try-in of the case or the ceramics. So as you can see here, we don't really cement it permanently right away because we want to check every details. We want to check the fit and we want to check if it's the right design for the patient or if there's a need for modification. We are doing it. As you can see here, there is a big cavity that is not savable. So we're gonna extract that in the future, like we're talking about a few weeks from now after we cement the case permanently. So do not worry, it's not actually included in the bridge, and that is for extraction and implant at the same time. The result is very stunning. Like, it's gorgeous and it's really beautiful and it looks natural. So we were able to address the patient's chief complaint from having the removable to fixed. This is, confidence booster talaga. It's because whenever she talks or smiles, there's no fear of yung nahuhulog yung denture or something like that, which, source of embarrassment that would lead to low self-esteem. So wala na yun. We were able to fix the asymmetrical and distribution of the teeth. Also, the smile follows the curvature of the lower lip, and the lingual locked upper right canine has been addressed, and also with the position of the premolar, very beautiful and well balanced. So the color, it's a little bit whiter, not too white, but it's clean white. So the pink porcelain mimics the natural color of the gums as well. So the purpose of the pink porcelain is also to add volume to the lips para it would look natural then, not collapsed. So incisal translucency is on point also. So in dentistry, especially with this type of dentistry, there are a lot of limitations. Like, we are talking about health, we are talking about the functional limitations, and we have to make sure that we were able to study the case comprehensively. Everything should be considered: the face, the health of the teeth, the habits of the patients, and everything should be well recorded. Kasi it's difficult to create something that is not properly planned out. So treatment planning is essential in doing this smile transformation or Apostol smile, because it could make or break the future of our patient. So we're taking this very seriously. So missing teeth or early or premature loss of teeth are very rampant in the country. So sometimes kasi parang we don't have the idea of the possible solution. We thought that we could just use denture or yun na yun, or you don't know that there are some solutions out there that could really enhance your smile and gain back that confidence that was lost, diba? Because of that missing teeth. So ang hirap nun, and that's why we're here to show you some treatment. This treatment might be suitable for you. Kaya if you have this kind of case, don't hesitate to message us or communicate with us through YouTube. We have IG also at Apostol Dental, and we have the FB page. So see you guys at the clinic, and God bless us all.